What's going on Facebook? Hey, it is Reagan, and we are live with Doc Talk. Today I have two awesome doctors from Southeast Texas, right here in Beaumont, from Southeast Texas Cardiology Associates. So here they are. Let me introduce them. What's up, guys? How are you, Doc?
Hey, Reagan. How are you?
I'm doing
good. Reagan, good to see you, buddy.
Hey, good to see you guys. Guys, for you watching, this is Dr. Bransford on the left and Dr. Sotolongo on the right, the two doctors at Southeast Texas Cardiology Associates. How are you guys doing today?
We're doing great. Thank you.
Hey, thanks for joining us, guys. Happy Valentine's Day. We're glad you're here. What better day to talk about heart health, heart questions than today?
Great.
So for everybody that's watching, they may not know who you are. So why don't you tell us a little bit about your practice, guys?
Okay, I'll start. I'm Dr. Bransford. I'm a cardiologist and an electrophysiologist. My subspecialty is electrophysiology. I'm an electrician of the heart. And what I do is put in pacemakers and defibrillators. We put in catheters inside the heart that get rid of irregular heart rhythms. My big brother here is a plumber, okay?
Actually, I'm his little brother, okay? He's actually his younger brother. I'm Rudy Sotolongo, and I'm the plumber of the heart, if you will. I fix pipes that are blocked, obstructed, aneurysms, transcatheter aortic valve replacements, carotid stenting of the heart, these kinds of things. So basically what we do, Pat and I team up together as he does the electrical work of the heart and I do the plumbing work of the heart.
Okay, awesome, guys. So y'all are an awesome duo there.
And the greatest thing is that we both trained at Georgetown University Hospital and had the same mentor that ran the cardiac catheterization laboratory and the electrophysiology lab, the same doctor. And he called me one day and said, "Hey, Rudy, I got a great doctor that wants to come down near your neck of the woods. And his daddy is a physician in Houston, and he mentioned where you're at, and we thought of you, and he's a great doc. I think we should interview this one." And I said, "Prof," I was referring to my professor, "coming from you, I definitely want to see him." Right. And that was how long ago, Pat?
That would be 25 years ago in October.
Wow, that's crazy. Y'all are still going strong.
Yeah, I had hair on my head when I came here.
Oh, man. Kathy just said, great team there. Thanks, Kathy.
Thank you, Kathy.
So we've been getting a lot of different questions about the heart, Doc, and one of them was, how has COVID affected, your heart practice? Has COVID played a big part, or anything going on recently, or?
The main thing, unfortunately, that COVID did was a lot of patients did not seek medical attention when they were suffering significant heart symptoms, warning stroke, angina, unstable angina. And some of them, sadly enough, didn't make it to the hospital because they delayed because of the fright of COVID. So normally, for instance, to give you an idea, the two hospitals in Beaumont do approximately 15 major heart attack interventions a month.
Wow.
It was shut down to about 5 or 6. And meaning that approximately 10 people a month over 2 years, just about, weren't making it to the hospital. We're talking about major heart attacks. We're not talking about the minor ones that didn't come immediately.
Hi, Kathy. How are you? Hey, couple things. We had there was data that came out of the New England Journal of Medicine that the number of people who had cardiac arrest jumped unbelievably during COVID. Because, again, people were not coming in. People were having positive stress tests in the office, but would not go to the hospital to have procedures done. So it's had an effect.
Right.
And it also had the same effect as the disease itself, having people coming in with a little bit of elevated troponin levels. That's the enzymes that show whether you've had a little bit of damage to your heart. We've seen occasional cases of people with myocarditis. But I think the biggest thing from our standpoint are people not going to the hospital.
Right. And just out of curiosity, how does COVID affect the heart? Like, what is the main thing that it does on some people?
The thing is that we tend to think of COVID as a lung disease, right? Or an upper respiratory and a chest process, but it's not. COVID is a vascular disease. COVID affects the little blood vessels and the large blood vessels and causes clots to form in the vessels. So if you think about it, COVID truly is a vascular clotting disorder that happens to affect the lungs, the heart, the brain, the kidneys, the liver, the fingers, the arms. A lot of patients, sadly enough, have had amputations
Wow.
due to massive clotting in the blood vessels that feed the hand and the arms. We've had here in Beaumont, we've had patients undergo amputations, because of the clotting problems with COVID.
Yeah, I don't think a lot of people out there think about the heart playing such a big role, but hearing that's crazy.
Well, it's the vasculature. It's like Dr. Bransford said. We see a little tiny in young people. You get a little myocarditis and a little bit of pericarditis and a little inflammation, and it's not a big deal. The heart proper, but the blood vessels clot up a lot and cause problems.
So out of curiosity, another person just asked, does family history affect heart health? Does family history have anything to do with your heart health?
Yes. Oh yeah. Genetics can trump a lot of things. Okay, just about everything. And you can't control your genetics. I try to tell that to people. You can't control your genetics, but you have to control everything else. Like, what would you say would happen if you have a positive family history for coronary disease or blockages in the arteries, and you're a smoker?
Well, that's like putting a fire to dynamite. You may with just a family history alone get by without any heart attack necessarily, or major heart attack. But as soon as you start smoking, or you have diabetes, or you have the other risk factors, untreated hypertension, you may then get the manifestations. What Dr. Bransford is alluding to is very important. The most important, powerful risk factor that you have is your genetics, your heredity. But the interaction of your genes with the environment is what leads to the ultimate event.
Right.
Does that make sense?
Yeah. Yes, sir.
In other words, if you've got a family history, you need to take care of yourself. You need to take your medicines, don't smoke, you need to exercise, and get down to your ideal body weight.
Right. Got to overcome. So is there a difference between male and female heart issues, like health issues? Do you see more males have more issues than females, or is that not a factor?
Well, after menopause, women and men have the same incidence of heart disease, heart manifestations. The symptoms of heart disease, like chest pain and problems with blockages, are a little more atypical. You got to be a little more careful in evaluating women, because they don't present and tell you, hey, I got this heaviness in my chest, I can't breathe. It'll be, I don't feel good today, I've had some palpitations, I've got a little sharp discomfort here. So they're very atypical. You got to listen to women, not just say, just because you're a woman, you don't have it. But let me kind of address Tammy's question. I see that she's asking there, you can reverse any disease with good nutrition. That's an important point, okay? Because, for instance, that's the whole basis of the Mediterranean diet. We prescribe our preferred method and diet system for heart patients is the DASH diet, DASH. The acronym starts for Dietary Stems to Stop Hypertension, from the National Institutes of Health. What it is it's a blended low-carb Mediterranean food, and it reduces cardiovascular risk.
Right. I was going to say that. There's clear studies showing that the Mediterranean diet will reduce cardiovascular risk.
So it's what you eat, has a major factor in preventing disease. No question about it.
So before we go on, just like Dr. Sotolongo said, guys, if you're watching, listen to your women, because today's Valentine's Day. You need to listen. That's your free tip for the day. Obi
listen in more ways than one. Listen.
That's right. Exactly, more ways than one. So Obi just asked, what's more important? Is it heart health, diet, or exercise?
Can I go first?
Shoot.
Okay. Well, I think they're all important. But let's just take a typical person. Let's say they're overweight. Okay. I think diet becomes very important because let's face it, diet is probably more important in losing weight than exercise. Okay. Um, it's probably 70% of the equation.
Maybe 85%.
Right. And by losing weight with your diet, and then you exercise, of course, but with your diet, you can reverse things like high blood pressure, diabetes,
This thing called metabolic syndrome, high blood pressure, diabetes, a lot of things.
I don't think there's a magic pill, but I would tell you that a diet is very important because it helps you to lose weight.
And you know what people aren't aware of? I think the diet is, I also agree with Pat, that diet is fundamental. Okay, what you are, what you eat. But the exercise part, it only takes 30 minutes, 3 days a week on alternate days to gain heart benefit and increase longevity. So it's not a lot, okay? I mean, it's just walking 30 minutes, 3 days a week.
Yeah, that's so important. And I think everybody can benefit from all of these, all these factors, a little bit of both or a little bit of everything to make the difference. Sarah just asked, is it recommended that youth and adults get EKGs as part of their yearly physicals for prevention screening?
Adults, for sure.
But maybe not young patients, okay? Because there are some recommendations with regard to that. For example, children playing sports and so forth. Part of it is that it's not really economically feasible unless you have some signs that point towards certain problems, such as a very thick heart. We call that hypertrophic cardiomyopathy. Okay, someone who has something called long QT syndrome. But you would see that on just a first echo. You don't need yearly echo. EKG. You don't need yearly EKGs for that. So I don't think the yield, with the amount of expense for yearly EKGs for young people, doesn't really give you the yield of finding something that makes it worth the cost.
Especially in young people, unless the young person has a family history, for instance, of sudden death. Okay, something like that, their pediatrician should consider getting an EKG. Other than that, they shouldn't. Now, adults is a different story. Adults should have an EKG as a screening for heart disease. Rest EKG is only so good because it's at rest. It's not stressing the heart, but it gives certain patterns which can be indicative of underlying heart disease.
Correct. Like a tip-off.
Right. Okay. Well, hi, Daddy. It's Scarlett. Well, hi, Scarlett. I got my kiddo watching you guys too, so I guess she's wanting to learn about heart health today as well.
Hey, maybe she'll become a cardiologist because we're going to need some.
I know, Scarlett. You hear that?
We're going to need some in a couple of years. Okay.
All right. Perfect. Dr. Bransford, this lady said she can't thank you enough and your team for saving her life.
Miss Gagne, it's not us. Okay, God takes care of everything.
That is awesome.
There's nothing I can take. I can't take credit for anything, okay? All good things come from the Lord. But, God bless you, man.
Wow, that's good news to hear somebody's life that's been saved.
Mary, God bless you.
Yeah. Tammy just said that she likes to eat 7 to 13 fruits, vegetables each and every day. Wow, you're dedicated. It's tough.
Keep it up.
Chris just said, here's a question, since it's Valentine's Day. Is there really a condition called broken heart syndrome? Is that true? Any truth to that?
You take that one, Pat.
It depends on what we're talking about. There is something called Takotsubo syndrome.
I think that's what they're referring to.
Yeah. It's
Takotsubo.
Yeah, it's a syndrome where someone is really worried, and it occurs more in women.
Stressed.
They're very stressed. And they will come in with a heart attack, but they have no blockages in their artery.
And it goes back to normal completely in 4 weeks. They come out with a blowout, big, massive heart attack, and the shape of the heart balloons, kind of like what the Japanese used to get the octopus from the sea. And that's where the name derives from, Takotsubo. And when we see that, typically the individual has been exposed to intense stress the preceding 6 months, major job change, major moving from wherever they've been living, deaths in the family, a lot of major stress, and boom, they get the broken heart syndrome. So yes, Chris, there is such a thing as a broken heart syndrome, but it comes right back to normal after,
And we should give a caveat for affairs of the heart that involve love and romance.
Oh,
Well,
man.
we probably don't have those answers.
Right. So this brings me to my next question. Somebody's asking, so does their stress and anxiety increase their risk of heart complications? I would guess so. All right.
I'm going to take that one, okay? As Jimmy the Greek would say, okay? Stress and anxiety is the intangible of heart disease, the unmeasurable, because we have one of the highest standards of living of any country in the world, but we also have one of the highest stress levels anywhere in the world, right? And stress and anxiety contribute to bringing out, like Pat said earlier, the genetics. You have the genetics for heart disease, and you put yourself into a lot of stress and anxiety, you'll bring it out.
Okay. Kevin just asked, he said, awesome doctors, great information. What technology are you guys using that is very, I guess, most impressive recently? Any new impressive tech out there?
Pat, why don't you let them know a little bit about some of the things you're doing in AFib, Watchman, ablations of
Clearly, we're doing AFib ablations. We do ablations of tachycardias from the ventricle. But we're also starting up a program of putting in these little devices called a Watchman device. And for people who have atrial fibrillation, who cannot be on a blood thinner, one of these is placed into the left atrium. And after about maybe 6 weeks on anticoagulation, you come off of anticoagulation, which is blood, something that thins your blood. So I think that's a great new technology. I think it's fantastic.
Something that I've been involved with quite a bit is implanting transcatheter aortic valves in patients that have critical severe symptomatic blockage in the main valve coming out of the heart. And I was mentioning to a patient today, my 2 oldest patients were 93 and 91, and they each went home in 12 hours after the procedure.
And to make that clear, you go from not having to have your chest open to having a plumber put something in your leg that goes to your heart to fix it.
In fact, I had a really beautiful letter sent to me by a heart surgeon that started the whole cardiovascular surgery program in our region, and I replaced his brother's heart valve, through the catheter. And he sent me a beautiful letter, very congratulatory, etc. And I was very happy and fulfilled that I was able to help his brother. And he said, but you did a magnificent job, but most importantly, I never had one of my patients that I replaced the valve look that good the next day. Because you walk out of the hospital, you don't have any incisions. Wow. Another thing that I do is exclude aneurysms, big aneurysms that normally you have to open the abdomen.
Well, what is an aneurysm?
An aneurysm is like a bulge in a blood vessel. If it's a normal pipe, the pipe is narrowed but then bulges out and can rupture. So a new technique that I've been doing for years is to go in with a catheter and use a stent graft and put the stent graft inside and occlude it percutaneously. Again, I've had several patients that I've done under conscious sedation with stent grafts be awake when they leave the cath lab and talk to their families and go home in 12 hours.
Now, what do you mean by conscious sedation?
It's when we give them sedatives and no anesthesia. They're lightly sedated. They're not intubated and no anesthesia.
Way easier.
Way easier in the body.
The technology, it's amazing how much improvement it's made just in the last 5 or 10 years, and it's just getting better. Like you're talking about.
I'm very fortunate, because internal medicine has about give or take 9 to 11 subspecialties. Ours from the get-go has had the most advancements by far. Unequivocally, the most new developments in technology, the most studies, randomized prospective, large, multi-thousand people trial than any other specialty in medicine. So we've been really fortunate
Right.
that we chose
We have
cardiology.
seen a lot, Gene.
A lot.
I can't even tell you.
That's
In
awesome.
fact, most of what we do today, most of what Pat and I do today, of the major procedures that we each do, we have learned and perfected after we finished our training.
Wow.
Courtney,
Go ahead, Doc. Go ahead. You got
I'm
this.
sorry. I just saw Courtney's question. Courtney, I think that's a great question. One of the things that we are seeing, Courtney, is that you, Courtney Wagner?
Yeah, that's
I know.
Courtney Wagner.
Hey, anyway, Courtney, this is what we're seeing. There is a little syndrome after people, especially young patients, after they get COVID, where they come in with shortness of breath and an elevated heart rate.
Mm-hmm.
We call that an inappropriate sinus tachycardia, where their heart rate, say sitting down is 105, 110. But normally it might be like 70 to 75. They're a little bit short of breath. We're seeing this in a lot of young patients. And what we're seeing is this is sort of a syndrome that's sort of self-limited after about 3 to 4 months. Okay. But nothing, so far, there's nothing, no long-term ill effects.
Okay. Kevin was curious if there's any thoughts on studies of COVID vaccine related to young people and myocarditis.
Carditis?
Carditis, yeah, there we go.
Actually, there are really not a whole lot of published studies on very young people with the vaccines, to my knowledge.
There's a few that have just come out. Maybe recently there's a comment on it. And I haven't had the chance to look at it yet. I'm talking about just came out just like a day or two ago. I just haven't had a chance to read it. Is there some concern in the ages of, say, 16 to 40 for those who have take the vaccine with the risk of myocarditis? There's some, mainly in males. But I will tell you that, I still think the benefit outweighs the risk. Okay, and there are some rare cases of that multi-organ system failure that you'll see with COVID, but they're rare.
Yeah. Hey, Kevin, you and Barbara, I want you to know we very much enjoyed having Alex shadow us, and he's welcome back anytime. Please let him know and give him our best.
Yeah, I tell Alex I have a whole lot to tell him. We had a nice chat, and there's a whole bunch of things I still have yet to tell him.
Awesome. Well, I have another question here. What are your thoughts on telemedicine? Do you guys do any telemedicine?
Before we tackle that, let me just answer Tammy. In our specialty, cardiology, an ounce of prevention is worth a pound of cure.
I like
No
that.
question about it. Excuse me. There's no question about it.
So, everything, there's nothing in life that's all good or all bad, right? There are things that are bad predominantly, like very bad, like COVID, but it brings some good. As a result of COVID, Pat and I started doing telemedicine with our patients, but we started doing telemedicine with the ALTUS emergency room in Lumberton. And it grew, it developed into a very sophisticated, very excellent program where we collaborated with the nursing staff personnel of the emergency room, the medical director of the emergency room physicians, the nurses at the hospital, and we backed them up completely 24 hours a day, 365 on cardiac patients and chest pain. And we have developed protocols for low risk, intermediate risk, high risk, observation patients. And what we do then is not only do we observe them and risk stratify them and do full consultations over the phone, we have electronic stethoscopes, we have equipment, we look at EKGs, et cetera, but we put them in a priority track. So in many cases, they get seen the next day in our office and they get tested the next day in our office. So this is one really good thing.
I think it's been great.
That came out of the COVID experience.
Yeah. So if you guys watching don't know, we have a partnership with Southeast Texas Cardiology Associates. They're, like you said, they're able to help us. If you come here to ALTUS Lumberton Hospital, we need to listen to your heart, or they need to listen to any, rhythms, they're just it's amazing. We can just let them listen right away wherever they are, and get the results that you need to get the healthcare that you need. So it's just
Reagan,
amazing.
let me give you a little feedback. I've heard from a lot of patients who've gone to ALTUS, and they love it.
They love the experience.
They love the experience. They have nothing but good things to say about you. And I'm not kidding. Even if they didn't come to us and we just happened to see them in the hospital, say they got to the hospital from ALTUS, and not to the office, they have nothing but great things to say about it.
Well, that's awesome. That's awesome to hear. Yeah, we love our community, and we're always looking for the ways to be ahead of the game, state-of-the-art technology, and be able to do this telemedicine with you guys, to be able to help our patients that come here through Lumberton. Just one more awesome way, to be able to make sure their health is what it needs to be. So thank you, guys. Thank you, docs, for always being there when we need to do our telemedicine with our patients here.
We consider it a privilege.
Yes.
So before you guys go, I have one more question here. Somebody just asked, when should you go to the nearest ER and hospital versus waiting the next day? So basically, they're just curious, when should they go to the ER or come see you guys? What makes it, such an urgent issue?
I'm going to start with we're going to start with plumbing, because that is the most, that is something that can most impact your life.
Your
if you
outcome.
make the wrong decision.
Your outcome. So let's divide that question on the plumbing side to two types, okay? One is if you know that you have coronary artery disease, i.e. blockages in the blood vessels that feed the heart muscle oxygen, the kind that can cause heart attack, where you may have had a stent or you've been told you had plaques or blockage, okay? Those kind of patients, if they get pressure, tightness, squeezing, aching, dull ache in your chest, going into your jaw, neck, arm through to the back with shortness of breath, anything like that, they should sit down, put a little nitroglycerin tablet under the tongue, wait 5 minutes. If it's not relieved, put a second nitroglycerin tablet and wait 5 minutes. If it's still not relieved, put a third nitroglycerin tablet and wait 5 minutes. If after 3 nitroglycerin tablets over 15 minutes, you still have chest discomfort, you must get immediately to the next nearest emergency room. That's if you have coronary disease. If you don't have coronary disease and you get a pressure, tightness, squeezing, aching, pressure, especially if you break out in a sweat or you get pale or you get nauseated, you got to just head to the ER and get diagnosed. But I want Pat now to explain a little bit about on the electrical side, if you get real rapid racing of the heart or fainting or blackouts, address those two areas.
So with very rapid heart rhythms, in younger patients, they may tolerate that for hours. And a lot of times they won't even come to the emergency room. But it may go away. But if it really doesn't go away after, say, 20 or 30 minutes, you really need to come to the emergency room, because they can stop it. Do you need to actually be admitted to the hospital? Probably not if you're under the age of 40. And if your doctor says to you, you have a heart rhythm that's coming from the atrium or above the ventricle, then fine. You can be seen as an outpatient, but to get it stopped, chances are you're going to need to go to the emergency room, okay? And then if you go to ALTUS, I'm going to do a shameless plug. If you go to ALTUS and they call us, you're going to be seen by us no later than 48 hours. If they call us that day, we'll see you the next day.
Right. So if you're here local, guys, right here in Lumberton, we can take care of you and they'll get you in. They can take care of you the next day.
And then the other part that I wanted Pat to address was fainting or blackout.
Okay, when you pass out,
and what to do, Pat, especially it's counterintuitive what you should do with a patient when you see somebody black out. And he explains it real well.
And most people who pass out, we look at it, you fall into one of two areas. Either it's brain or it's heart. Well, about 85% of the time, it's going to be heart related. And it's going to be, and not so much as bad heart related, it could be something as simple as a common faint. I still think you need to go to the emergency room and let them do an ultrasound on you. Because if you have a normal ultrasound, then you are safe. You have a really good outlook.
You will not die suddenly.
Exactly.
Of which there's 750,000 episodes a year in this country.
Right. When people pass out, if you've got a weak heart or you have a history of a heart attack, yes, you're in that group that has a real risk of possibly dying. But if you've got a normal heart, you've got a good outlook, and then further workup can be done in a doctor's office. And again, you go to a place like ALTUS, you will not be waiting 3 weeks to come in and see a doctor. Okay.
Right.
I promise you that.
And it just gives you that peace of mind. You know, if you're doubting, it doesn't hurt just to go get checked out or looked at, like the doc said. It's better to have, just know and have that peace of mind than for something to escalate.
But even near faint, a severe near fainting episode should be evaluated.
Mm-hmm.
Yes.
Thanks, docs. Thank y'all. One more question somebody just asked. This is an awesome question. Travis wants to know, what is the favorite part about being a cardiologist, guys? That's a good one.
Well, can I start?
Sure.
I used to think that it was the best part was, having patients and they'd be happy and you've done your job. But really the best part is, or now that I've grown a little bit, is knowing that I'm doing God's work, no matter what the outcome. My whole life has changed in that I'm here to do what God tells me to do. And Rudy and I talk about this a whole lot. When I die, I've got to go up there, and I would like for him to tell me I did a job well done.
Amen.
I feel that, like the patient that I just saw a few minutes ago, God gave me the ability to touch his life. He's desperate. He's 79 years old. He's been through enormous heart disease for 20, 25 years. He's hurting. He doesn't know what all is going on, and he wanted my help. And I was able to do a cardiac catheterization, relook at everything. In fact, Pat and I have been working on him both electrically and plumbing. And we came up with a beautiful plan based on the information we obtained today that's going to markedly improve the quality of his life and the longevity of his life. So what that does for me is it has become, after my family, the meaning and the purpose of my life.
Wow. How awesome is that, docs, that you get to be God's hands? Literally, you get to change somebody's, life.
Well, when people say things to us like, you saved my life or this or that, Pat and I always say the same thing, okay? No, we didn't. We were just innocent bystanders.
Now we've seen miracles.
Yeah. And, patients can go to, all kinds of heart doctors out there. There's tons of doctors, but how awesome is it to get to go to somebody like your office, you're, in Beaumont, where you actually, do it in a ministry. You have God involved, and that would give me peace. I mean, just to know that you put God first before you do anything. So that's awesome.
Well, God's involved in everything,
Thank you.
whether we like it or not.
That's right.
And we do love it.
Well, docs, hey, thank y'all so much for tuning in today on Valentine's Day. Is there anything you want to say to the audience, everybody watching, before I let you guys go today?
I'd like to say thank you to the audience. You guys are so wonderful and kind. I'd also like to say thank you, Reagan. Don't be a stranger. Okay.
Thanks, Reagan, for having us. And everybody spread the love and the cheer and give your favorite Valentine a big kiss and a hug.
That's right. That's right. You guys got to get out of here. Y'all got y'all spouses to go take care of and go have a fun Valentine's night. So
we will.
You too, Reagan.
Hey, I'll see y'all soon, guys. Be careful out there. All right.
Thank you, buddy. Bye-bye.
Hey, everybody, thank you so much for tuning in. That was Dr. Bransford and Dr. Sotolongo. They're in Beaumont at the Southeast Texas Cardiology Associates. They're awesome. They do everything, and they really care. They put God first. And so when you're being taken care of that you have anointing with God leading their hands and taking good care of you. But hey, guys, we're here 24/7 at ALTUS Lumberton Hospital. All of our ALTUS locations, we're here 24/7 to take care of you for all emergencies. There's no situation too big that we can't handle. And we have our free medical screening. I mean, if you're ever having heart issues or any kind of issues, come in. We do free medical screening. It's better to get a peace of mind, get looked at, than to let something escalate and get worse. So come see us if you have any questions, that free medical screening. We're here for you guys. We got that VIP treatment for you. You can always even do an online check-in on your way. Pull out your phone, do an online check-in. We'll have somebody waiting at the door to take you back to give you that awesome red carpet treatment. But anyway, guys, we love you. We're so appreciative. Go have fun. Go have an awesome Valentine's date with your spouse, significant other. Enjoy it. This is your free tip, guys, so you don't get in trouble. Go get some roses. Go get a card. Go get a box of chocolates, and go have fun. Guys, thank you so much. Happy Valentine's Day. We will see you guys next time. Thank you so much for tuning in.